Hi, I'm Felice with Better After 50. I'm leaning in a weird way because we're doing the 6-foot live interview, the 6-foot distance. And I'm here with Deb. Lean in for a second and then Deb Rusckowski. And we're going to hear Deb's story about how she created something here on Martha's Vineyard, where we are, that has helped people in a way that even she couldn't imagine back in March. So I'm going to move my face off of here and we're going to focus on Deb and hear what she has to say about launching. So Deb.
Yes. Hi, Felice. Thanks for having me.
We're so glad you're here. You have launched something quite amazing on Martha's Vineyard. Can you tell us what it is and then we'll get to the backstory?
Okay, sure. So it's a COVID-19 drive test through. It's not exactly unique because there are others around the country, but it's unique to Martha's Vineyard. And so it's a test through, a drive-through testing site at the high school.
Yes.
Yeah.
So this site, it handles how many people on the island?
Yeah. So, well, that's always the challenge, right? And so since the inception of this, we went live, I believe, at the end of May. We had a lot of planning committee meetings prior to that, but went live after much preparation. And so technically, it has 3 tents with 2 stations each. We can do well over 500 cars tests per day.
Oh, 500 a day. Okay.
Yeah. And that's our goal. Yeah.
Okay. So I happen to be a resident of Martha's Vineyard, and it is a gift to this island that this site exists. I know many people's biggest fears are maybe they have a family member visiting. They'd like them to have a test before they come visit. But here we are in the middle of the summer. Back in March, I remember seeing something you had, or hearing you say, I would like to do something to help out in this crisis. So tell me a little bit about your background and how you found your way to helping launch this site.
Sure. So, although I'm working at the United Nations in New York for the most part and in the area of human trafficking, my background is a critical care nurse. And then I was teaching nursing as well at my alma mater at Northeastern University before I moved to New York. So I give you that background because there's something in my DNA that I absolutely have loved medicine, will always love medicine. When the outbreak happened in New York, I put my name on the list to sign up as a volunteer to go back into the unit to help out my fellow nursing colleagues to help them with the patients. And I wanted to do that. My husband was very scared. He just was, and understandably, we didn't know as much as we do now about this virus. It was really something that I hadn't been in the unit for a number of years. And so he said, please don't do this right now. Somehow or other we'll get you involved in some other way.
But you were ready.
I wanted to jump right in. I wanted to jump right in.
But you didn't know exactly how.
Yeah, and I did know I have contacts, of course, still in the healthcare system.
Right.
And could easily have gone back in, but I did go on, I put my name on a volunteer list, and ironically, I guess it wasn't meant to be because that list was never used in New York. They utilized all the staff that they had not furloughed. So the people that weren't getting the elective surgeries, the people that weren't going to the ORs, weren't getting other procedures done, they used those staff to bump them up to the step-down units and things, so they could use the step-down unit people up to the ICUs. So they used all the staff.
All right,
and
so that wasn't going to be your thing.
It wasn't my thing.
Yeah.
So anyway, so when we got here, we were...
Which was when?
Well, we were here in March for 4 days, realizing that, it was still kind of a funny time here. People were very afraid of the virus. They didn't want any outsiders in. And also Steve, with my husband, his job, he had to make sure that he could easily get off this island. And spring, if you remember, was a little bit iffy with the weather. And there was a lot of storms and fog. So we thought it best not to stay here. Just for a lot of reasons. So we left here and we came back the weekend of May 1st. And it's our anniversary, and so we got married here, and so it's very emotional. So we came back just for the weekend. Well, we haven't been off the island since.
That is many people's story, but what happened to you from
Yeah.
May 1st on
So
is
yes.
quite a story.
Yeah. So what happened was, you know, the landscaper Donna Romas. Well, Mike and Donna Roma has been a good friend of ours for many years, and he wasn't sure exactly what Steve did with Quest Diagnostics and what capacity they had of helping in the testing. So he said, Steve, would you be able to help this island with the testing? He said, yeah, sure. He says, but what's the plan? I said, the plan? There really isn't a plan. So Steve and I decided to help make the plan. And he had first said, Deb, you're in charge of this plan and project management. So in the beginning, just trying to pull everyone together, the right people. We needed a sponsored organization. Like, so for instance, I said it wasn't unique in the beginning. Well, this testing, a drive-through testing site, isn't that unique because look at all the ones in Walmart. Look at all the ones in CVS around the country. I believe there's like 860 Walmart, 640 some odd of CVS. So that part isn't unique, but you need the CVS or the Walmart partner. So we were just entertaining ideas of Stop and Shop pharmacy. It'd be good to have a pharmacy involved. We knew the hospital was a little overloaded already, so we didn't want to bother them. And so what we did was Ron Rappaport and Mike Donaroma, myself, and my husband Steve made up the steering committee, the initial steering committee. Ron made the suggestion of Island Healthcare, and when we learned that it was an FQHC, which is a federal qualified healthcare center, that was, and they are charged with giving access to the poor, or people that don't have access to healthcare. They provide healthcare to.
Right.
So this was a perfect partner, so we thought, and we wanted to move forward with them. So we checked with them, and they thought it was a good idea. But then we added more people to the circle of, committee, and we learned with the Board of Health members and some of the other folks on the committee that some people were involved in contact tracing, and they had also been involved years ago setting up a flu clinic. They did 16,000 flu shots in 4 hours.
So there was some background here,
Yes,
in terms
which
of
was
how
amazing.
to run something like that. That's incredible. But this sounds like very bureaucratic on a certain level. So you're talking about beginning of May. When were you able to begin testing here? I mean, like you found your sponsors.
Yeah.
You understood the logistics because you had some background. I understand what you're saying in terms of the flu.
Yeah.
But now you need to get
Sure.
the test center open.
Yes.
So
So certain things had to be worked with Island Healthcare.
Right.
They needed to get up to speed on how exactly this would work in regards to making appointments. They had a call center that they had used down in Florida for their purposes. They said we can use them again. After you make the appointment, okay, we have to set up all these tents. We have to get the people to get them set up. We have to get the clinicians. They used the Medical Reserve Corps here on Martha's Vineyard.
I think none of us realize how complex this process is.
Yeah, and then you had to train everybody. We had to have a little practice run. So I was part of, I think 10 of us that we just pretended we were patients, and we went through and got tested. We had to practice the ability of Quest Diagnostics to pick up the samples, get them to the ferry, get them on the other side of Woods Hole to pick them up by courier, get them to the Marlborough laboratory, testing, and how much of when would they be returned and the results. And it was a 24 to 48 hour turnaround.
That's amazing. Well, with so many issues about testing across the country, and frustration that people aren't able to get the tests that they, when they want them.
Right.
This is really interesting because you can hear the backstory on how it came to be. So between May 1st and when did that first test?
I think the first one might have been, let me see, it was the weekend after No, it was the Thursday after Memorial Day weekend.
Whoa! So you did that in a
Memorial
month.
Day was May 23rd. It was early this year.
Yeah.
And we were trying to get it for Memorial Day weekend, but we didn't quite. We missed that mark, and we got it the Thursday after Memorial Day weekend.
All right.
So,
Well, I mean, when you talk about
pretty good.
launching
Yeah.
something, I understand you're not inventing it, you're
Yeah.
replicating pieces of it, but getting all those players together, particularly being on an island and then getting the results back. Bravo.
Yeah. Thank you.
That is amazing. So what is now, how many tests have there been? Do you
Yes, as of last night, we checked numbers. It was 7,600 we've done. There's been 16 positives. And
that's remarkable.
yeah, but I think the 16 positives, even though it's a very low number, it gives us pause to know that we made a difference. And we made the
Yes.
difference in each one of those could have infected a couple hundred people. And had they infected the steamship, for example, or somebody that could have shut down the island, it would have affected all the businesses and everything like that if people couldn't come here. So we're still not out of the woods. We have the busiest month is August.
Right.
We're really encouraging everyone to get tested. We hired 2 dynamo marketing young girls, and they are just so full of energy and
Yes,
enthusiasm.
wow.
So we're just we're trying to get everyone and explain to people. So many people don't understand that. Oh, I feel good. Why should I get tested? Oh, I could be positive today and or negative today and positive tomorrow. But it's really, I'm telling people it's a moral obligation. You're not doing it for yourself. You're doing it to see if you're an asymptomatic person that could be carrying it and shedding the virus. And that way, you're protecting your family, your loved ones, your friends, the businesses, the economy, everybody.
Well, I agree. We have our kids live on the West Coast, so this has been really challenging. We had our brother and sister-in-law come to visit yesterday, and they got tested the morning they came.
Perfect.
Not on island. They did get their results the same day,
Wow.
but it was really cool to have them walk in the door and be able to just be together.
And know that you're negative.
Yeah.
That's the thing. We are actually...
And I know it doesn't mean that everybody's going to be fine
Right.
the next day or the next day, but
You've
it was an
taken the initial
incredible
precautions.
way to begin a visit,
Yeah.
feeling a little more at ease.
Yes,
Yeah.
yes. And the governor has now mandated for 14-day quarantine for various states that come here.
Most states.
Yeah, and so we have now teamed up with the Steamship Authority to put our information on making an appointment the day of arrival right on the reservation page.
Oh.
So now I'm working at the site, and I love it, but we're getting a lot of cars all packed up right from the boat.
That's
And-
fantastic.
Yeah, and so
And how long does it take to get the results?
okay, we did have a surge in the demand was high nationwide, and we had a little blip there last week. So it was up to 7 days, and that we know that's a long time. Now it's better than 14-day quarantine, but still, that we're not satisfied with that. So Quest really worked hard and increasing their capacity, and so now we've got it down to about 4 or 5 day, and we're still working to try
Right.
to make it.
Well, we
further
did the
down.
test and we had it was 2 days and they did
2
a
days.
fantastic job. So
Great.
hopefully it will get back to that.
Right.
So Deb, you've gone from critical care nursing background, working at the UN, to helping us on this island feel safer
Which I
with the
love.
COVID testing.
Yeah.
And I guess you really are a true better after 50.
Oh, I am. I definitely feel better after 50, Felice. Absolutely. Yeah, there's a freedom with it.
Yeah.
There's a certain freedom with that, and you can just, you know what your passions are, and you know how you want to give back, and you just do it.
Yeah.
And somehow, when you do something you love, it's easy.
Oh, wow. No grass has grown under your feet. So
And I love all the people that I'm seeing, and whether I know them or not, that are coming through the line, and I'm just saying, it was nursing the way it was meant to be. No paperwork, no bureaucracy, just treating the people, and they're lovely. They're
Yeah.
lovely, and everyone seems to appreciate it, and everyone's so patient. So
we are all so
yeah.
grateful.
And hopefully we'll get up to that 500 cars per day.
Oh, that would be incredible.
Yeah.
So I'm going to lean in, as they say, and signing off. Deb, we've learned a lot from you. Thank you so much.
Thank you, Felice.
Okay.
Bye-bye now.